What's up, you guys? Welcome back to my channel. My name is Stephanie. For those of you who are new, I am a nursing student. Happy Thursday. I am about to head into my orientation for my clinical rotation. Quick update for you guys. For those of you who watched my vlog from last Thursday, you guys came with me to the hospital to pick up my ID. Well, they did end up changing our clinical site very last minute. It was actually like a few days ago when our professor emailed us. It turns out that only like 2 out of the 8 in my clinical class got approved to go to clinical at the hospital, and the rest were just gonna have to stay home and do like iHuman assignments, and so that would have been really whack. All of us are actually really close in all of my classes, so I rather us all be together, learn together, and have the same experience together. So it turned out okay. So yeah, it is about 7:35 now, about to head in a little bit. It starts at 8 o'clock, and we should be there until about 4, my professor said. So this should be fun. Not sure exactly what to expect. So gonna bring you guys along with me. Not sure how much I'm gonna be able to record, but I'm gonna try to record as much as I can and let you guys know how it goes. All right, so let's go. So we are back home from clinical orientation. Sorry I didn't stop to talk to you guys as soon as I got out of there, but we did leave pretty close to rush hour and it was pouring, so I wanted to get home as quickly as possible. So we did get home, I took a quick shower, and I'm freezing, so I just threw this hoodie on and wanted to sit down and chat with you guys a little bit, tell you how orientation went. Now, a little bit of background info. At my school, nursing students usually start off at the nursing home for their first clinical rotation to practice fundamental skills like vital signs, assisting with ambulating and repositioning patients, changing beds, and things like that. Now, because of COVID, they did not want us to go back to the nursing homes. This is the first semester that we're kind of like slowly getting back into the clinical setting. And so they switched it up a little bit and wanted us to start off in the hospital, doing the same things, but in the hospitals. Now, the hospitals are also being very, very strict on who they're approving, how many students they're approving. And so it's been pretty difficult getting into the hospitals as well. So turns out that the CDC extended the vaccine workforce to include all healthcare students, so including nursing students, of course. So what we'll be doing is administering COVID vaccines. We will be working with the geriatric population, which is a little weird because they originally did not want us to be back with the elderly, but we will be administering the 3rd dose and the booster shots at this point. So these patients will be less likely to get the virus now that they're, getting their final shots. So yeah, we'll pretty much be doing rotations. Some of us will be assisting the nurse practitioner with diluting and preparing the medications. Others will be assisting patients with checking in and explaining the procedure, providing any education that's necessary. And then some of us will be administering the vaccine and we'll be like switching off. So super, super exciting. Sorry I couldn't really record much today. There wasn't much to record. I mean, we were really in a room with a projector and just getting to know the facility and the different types of vaccines. And we also did our technical training, learned the electronic health record system, got our logins, and just learned how to document for each patient. So yeah, super, super excited about that. It sucks because we won't be back there until about, 2 weeks from today, because next week is Thanksgiving, so we'll miss next week. We're actually behind the other classes because the other classes went to orientation last week when we missed Thursday for Veterans Day. So we missed orientation last week, had to do orientation today, and the other classes already started administering the vaccines this week. So we'll only have like 2 chances that we'll be able to go. But you know what? I'm super grateful that I even get to have this experience. I was talking to this one girl. She's actually a 3rd semester student, and they threw her in with us. And she happens to be in her peds rotation, and there's just nowhere for some of the students to go. And so she is going to be giving shots with us. And she was telling me how the only other time that she went to clinical was for her OB rotation, and that she just stood there and observed. I mean, she went one time, didn't do anything hands-on or anything like that. And it's just very unfortunate. I know that a lot of this was inevitable and out of our hands, how everything just shut down during the pandemic. And you know, many students weren't able to take advantage of the clinical experience while studying. So I'm just super grateful and super blessed for this opportunity, and to be able to be doing something and just engaging with patients, different healthcare personnel, and things like that. But yeah, I don't know if I'll be able to take you guys with me. Probably not. I definitely can't record inside the facility, but I will definitely keep you guys updated and let you guys know all about it. Please let me know how your programs are going. If you guys are going to clinicals, how the hospitals are handling it, let me know. I would love to hear how it's going for you guys. Thank you guys so much for tagging along with me today. I hope that you enjoyed today's video. Please give it a thumbs up if you did, and subscribe so that you don't miss any other videos I do post. Till next time.